Let's talk about acne scars. When you have that pimple, in order to prevent the bacteria from running out and infecting the whole body throws a fibrous wall around it. And then the white blood cells, the soldiers of the body, and the bacteria, now they start to fight with each other by throwing biochemicals at each other. These biochemicals don't only destroy each other, they destroy the dermis. Aftermath of pimples is fibrous wall remains, dermis is destroyed, that's why you get the holes. And there's sometimes tearing of these fibrous walls, not all the time, I think about 20% of the time, there's tearing of these fibrous walls down to the base. So that's caused the holes, the pits. During the healing process, body sometimes throws hyperpigmentation. It can be either brown or red pigmentation. This hyperpigmentation is called post-inflammatory hyperpigmentation. And in some cases, when it's red, they call it post-inflammatory erythema. It's actually the same thing. Melanin has two pathways. It's got a brown pathway, it's got a red pathway. We're Asians, you're used to the brown pathway, right? Pimples sometimes get the red, sometimes get the brown. Two kinds of scars: holes, atrophic scars. Could be mild, could be severe, really thick, hard, fibrotic. Depends on how much reaction the skin had to the infection. And colored scars, two colors, red and brown. Treatment for colored scars is really easy. Got a stone in the garden that's too big for you to remove, take a hammer, break it up into smaller pieces, your body can remove it. All of us use a picosecond laser to break the pigmentation into smaller pieces, and the body removes it through the normal waste removal process. If it's shallow, a little bit of pigmentation, it can look very dark, very easy to remove. You get a big pimple, you're pressing and squeezing it, and so there's a lot of pigmentation that's deep, may not look so dark, very difficult to remove, needs many sessions. There's a limit to how much laser energy your skin can take. I have to stop, let your skin rest before I do the next session. We use what we call endpoints. We stare at the skin when we're doing the treatment. We look for the immediate reaction of the skin to the laser energy. Is the spot breaking? No, more energy. It's breaking. Can the skin take it? No, stop. Next session. So we try and optimize the treatment to get to the depth, break the pigmentation, and make sure that we don't create a burn or blister on the skin. Just keep doing it. Now, if there's no lighting, it could be a lot, it could be deep, more sessions. Shallow, deep, little bit, plenty, I don't know. Every time we do the laser, we see the lightening. Slowly you get what you want.